Howdy, y'all. This is Dr. John back with another all too quick session. I'm going to cover several days worth of thyroid disorders today in about an hour, or about an. I'm going to take about an hour to cover several days of thyroid disorders, and I'm going to do that today. So that's a little more clear, I think. And before I start, I have been saving the other questions for the end, the ones that are kind of specific and less, I think, relevant maybe for the group. So I'm going to take a few of those up front. We just got a bunch sent over today. So I'm going to take a couple minutes on those, and then I will talk about thyroid disorders.
Okay. What is the relationship between depression and leaky gut?
Massive. Every week, I believe, there is a new study out showing the horrible effects of leaky gut on the brain and on neurotransmitters. And in fact, there are many people that believe you cannot fix these mental emotional diagnoses until you fix the gut. And that goes for everything from concussion to ADHD to anxiety, that you have to fix the gut. Now, I believe they can be done simultaneously. In fact, I think it's better off if we do that simultaneously. But if you don't treat the gut, it's going to come right back, because that's the core, that's the key to inflammation. The gut is wide open. You've got 4,000 square feet of surface area. You've got 100 trillion microbes that are fighting over that surface area. And if your gut loses the turf war, then you will have massive numbers of inflammatory chemicals and cytokines that penetrate the barrier, hopefully the barrier of your intestines, and get into your bloodstream. And from there, they go everywhere and cause massive inflammation. So huge, huge correlation.
Okay, I think you answered the next question. What about leaky gut and ADHD?
Yeah, it's one of the first things I would treat with ADHD. Couple things that we look at are iron levels. Iron levels are very low usually in ADHD patients. That's somewhat because the gut lining is so damaged and impaired that patients are not absorbing iron. And then some of them become picky eaters because things irritate their intestines, and a few other reasons why they'd have low iron. We also look at zinc and copper levels for the same reasons, looking at absorption and utilization. And those are really three of the biggies. However, the biggest problem there too is the brain is on fire. You know, there's a great book called Brain on Fire, which is a little more serious than what we're talking about, but still it's a great indication of the problems that happen with brain chemistry from seemingly unrelated causes.
All right, next question. I've gained 35 pounds in the past 2 months. I went from eating gluten-free, sugar-free to eating whatever I want, whenever I want. Haven't been dealing with life very well. Is that fast weight gain because of leaky gut?
Well, partially it could be because of leaky gut. As I mentioned before, if you look at the work of Dr. Alessio Fasano, which I highly recommend that you all just pull him up, take a look. Fasano is very clear in his and from his studies that every single time, no exception, every single time you eat wheat or glutens and gliadins, you will have transient leaky gut. And transient leaky gut means you also have, and this he proved very clearly, transient leaky brain, which then, this is kind of going back to the other questions also, which then changes your entire brain chemistry to deal with the inflammation. Now, if you pour wheat and sugar, well, let's say if you pour sugar on it's just like putting gasoline on a fire. It doesn't matter what else is wrong, the sugar will make it worse. It is the most evil product we have on the planet. And I would recommend that you look at some of the books on sugar that have been written by professors at UCSF. And it's pretty frightening. I mean, very, very frightening. And you can also see the incredible setup and the lies told by the sugar industry so that we believed that fat was bad and sugar was okay. So yes, if you've been eating gluten and sugar and you have leaky gut, you are destined not only to gain weight, you're destined also to have depression, probably anxiety, inflammation, and body pain.
Okay. I had COVID 2 years ago and still don't have all my taste back. Do you know if that would have affected the bitter part of my tongue doing its job with sending signals to the brain?
Yeah, it would. Any lack of taste is dangerous. Lack of the bitter taste is very dangerous because that sets up your entire gastrointestinal tract to be able to, and other organs also, to be able to do their jobs. And so if you can't taste bitter, you're not going to release the chemicals that are going to turn on your pancreas and your gallbladder so that they are ready for the food that's coming, so you won't get proper absorption and nutrition. So yes, that's a big problem.
Okay. Another question. Bone bruises. What are some DIY things that might expedite healing?
Well, the question is in the plural, bone bruises, and I'm wondering how someone got those. Bone bruises are actually not very easy to come by. You usually have to do something pretty extreme. Car wreck, bicycle accident, football injury, falling down over a curb or something. And usually you're going to bruise one bone, maybe a couple. So I'm curious about bruises and wondering if there's some underlying problem going on. And so with bone bruises, one of the main things is just rest. However, we have tons of tools in our office that we use for that. Acupuncture is extremely powerful for bone bruises because or electroacupuncture in particular, because when you stimulate the area around the bruise, you bring in what's called the soup. And that has 15 major chemicals that are very, very healing and will reduce and or eliminate inflammation. And so that's a key piece of that. Plus, we will do a variety of electrical stimulations, pulsed electromagnetic fields. We would do red light therapy and infrared therapy, which pull, again, the inflammation out and are very, very helpful. And often we would have someone lie on that mat, one of those mats, and then put a smaller device over the top so that the bone bruise area is completely surrounded by these healing wavelengths of light and other wavelengths that are very powerful.
Okay. Are dried elderberries safe to eat? Whether added to a smoothie, fruit salad, oatmeal, chia pudding, etc.
I don't know, honestly. It's not something I've ever dealt with. I've never been asked that question before. I have read and or heard that there's a problem with elderberries if you eat them raw. Now, I have a lot of products that have elderberry in them, but of course that's processed. So I honestly, unfortunately, do not know the answer to that question.
If bonobos are humans' closest living relatives, sharing 98.7% of our DNA, and bonobos eat mostly an entirely fresh raw fruit diet, and fresh fruit is so high in vitamins, antioxidants, enzymes, structured water, etc., why is TCM so anti-fresh raw fruit for humans?
Well, there's a supposition there that's kind of the base, I guess, of the question that I have not found to be, to be the case. I'm not against fresh fruit. I'm against timing of eating, or not against, but I'm very careful about when I think people should eat fresh fruit. I think that's a really, really big issue. None of my instructors were anti-fresh fruit. Again, it was more timing. Some of them felt it was, that a lot of people ate too much of that and others didn't. Most of my instructors ate fresh fruit. And so that is news to me. So if I'm supposed to be against it, I'll work on that, but I didn't know I was supposed to be against it. Now, there are lots of problems, obviously, with fresh fruit. You have very high histamine levels if it's eaten at the wrong time, if it's eaten too late. Even a day after it is really, really perfectly ripe, then you can have severe histamine problems. And if you eat it a day before, it's perfectly ripe, you have leptin problems. And either of those leads to massive inflammation problems. So those are some difficulties. You have to eat the fruit perfectly. So I am absolutely for, I grew up eating fruit off of our fig trees and off of our plum trees, which we had lots of them in my home in Napa. And I'm all for that. The danger is getting it at exactly the right time, right? So that's the issue. It has to be perfectly fresh, not a day too late or a day too early, because either of those is a problem. And this is one of the things with dietary issues in general, is we can make sweeping generalizations about whatever. I have patients eating carnivore diets that are doing phenomenally well. I have patients eating vegan diets that are doing phenomenally well. I've seen people eating vegan diets that are near death because they ate them inappropriately. And so that to me is really the issue. Now, one of the things is that fresh fruit, according to Taoist practices and traditional Chinese medical practices, which are largely based on Taoist practices, fruit should never be eaten with other foods. Maybe some lettuce, something like that, but it should never be eaten with protein. It should never be eaten with carbohydrate, because fruit ferments. And so if you put 2 ounces of meat in your stomach and then you have fresh fruit, well, the fruit is going to sit there in an acid bath and it's going to ferment. Same thing if you eat it with carbohydrates. So the idea of people eating, say, oatmeal with fresh fruit in the morning, I don't like that idea. One, it pushes their blood sugar up too quickly. Now, for a lot of people, that's not a problem. But for most of my patients, that would be a significant problem. And also then they run the risk of fermentation of the sugars being there, or the fruit sugars being there with the carbohydrates. So I'm absolutely 100% not against fresh fruit. I am just pro being very careful. Okay. That's it. And those bonobos, we share a lot of DNA, but when you start looking at DNA, we share a lot of DNA with pretty much everything. It's that extra 0.5%, that extra percent that can make all the difference. I'm a firm believer, looking at dentition and looking at the digestive system of humans, that we were designed to be omnivores. Now, people can argue with that, and I'm fine with that. But our stomach, we don't have multiple stomachs. We have a moderate length intestinal system. It's our food goes through and gets much fewer digestive enzymes than the pure plant eaters, and it's way longer than the pure carnivores, and so we don't get the putrefaction, or so they don't get the putrefaction. So even though we share a lot, we don't share 100%. And I would be looking at that dentition and see cultures that are really, really happy, that do eat lots of things other than fruit. And there are cultures that don't ever eat fruit that are very, very healthy. So again, I think some of it depends on genetics. Some of it depends on location of where we live. Some depends on energy requirements. But I think there are a lot of diets that can be effective for different people. Okay. Anything else? No. That's it. Okay, cool. So I had promised that I would talk a little bit about thyroid today, and in response to a question. Now, this is going to get a little bit technical in a couple places, and I'm going to walk you through it. And so if you don't get it at first, don't worry about it. I honestly had to hear the thyroid cascade, or actually read about the thyroid cascade, a dozen times probably. I can remember exactly where I was standing and what the weather was like and what I was doing the day it all made sense to me. So get what you get. Next time you hear it, you'll get a little more. The bottom line is there are a couple of things that I think are very important that you look at. Okay. And I'm going to share my screen. And we're going here. Okay. I think that's it. Okay. And so we're going to look at thyroid disorders. It says an advanced integrative approach. It's actually a kind of medium integrated approach. I'm going to talk to you about things that your doctor doesn't, but I'm not going to speak to you in a way that I would speak to my acupuncture students that are also doing functional medicine. Okay, so symptoms of thyroid disorders. And up there it says, were we better off before the TSH test? And the answer is in many ways, yes. And the reason is this: when you look at those symptoms, if you came in to a doctor with those symptoms, particularly if there's more than one of those, before the TSH test was popularized, they would start treating you for a thyroid disorder, just flat out. Now, if you came in with that entire list, but your thyroid stimulating hormone, which by the way is not a thyroid hormone, it's a stimulating hormone. But if you came in with what they considered a perfect TSH test, which may be way outside the range that I think is perfect, but if you came in with that, even though you had this entire list of symptoms, you might not get thyroid treatment because they're basing the treatment to the test, which personally I don't think is ever a good idea. Tests are valuable. They give you tremendous amounts of information. They are not the end all be all. There are many things that are more important to look at. And this is in all areas than the test results. Again, they are one piece of the puzzle. I love testing. I do testing every day. However, I also keep in mind that there are lots of other things that we can look at. Okay, hypothyroid. Now, I'm not going to talk about hyperthyroid today because it's dramatically less likely to affect you. And I just know there's not enough time to go into that also. But if you look at these symptoms, you'll see that pretty much it can affect anything. Delayed reflexes, hoarseness. People don't think about that. Why am I getting hoarse? Is it my lungs? Is it my, no, it could be your thyroid hormone is bad, or your thyroid is actually swelling and pressing. Poor hearing, hair loss, paresthesias, odd sensations in your body, constipation, all of the menorrhagia, which is really long bloody periods, menstrual periods. So any of those can be a sign of hypothyroidism, even something like carpal tunnel syndrome. One of the first things I do if someone comes in with carpal tunnel is first actually check them to make sure that's what's happening. Over a third of the time, it's not even the carpal tunnel that's the problem. And then the second thing is I'm going to test them for their thyroid to see if that's where the problem actually lies. Okay. Now, you see this chart? And I'm going to go back here for a minute. They're symptoms of thyroid disorders. Those are symptoms of iodine deficiency. If you look, they're the same thing. They are exactly the same thing. That's because thyroid hormone is primarily made of iodine. It's made of iodine molecules that are linked with the amino acid tyrosine. But iodine deficiency is a huge cause of thyroid disorders. That's why iodized salt, they started putting iodine into salt, I don't know, in the 40s maybe, I'm not sure, because there was no iodine in the soil. There was a report in the 1930s to Congress saying, hey, we have almost no minerals in our soil, it's so deficient, and one of the minerals that's missing is iodine. And if you live not near the coast, then you're probably not going to eat a lot of fresh fish. You're certainly not going to get any seaweed. And so people in the middle 80% of the country were very likely to be iodine deficient. So they added it to the salt because pretty much everybody was using salt. Well, now we know that regular old table salt from a lot of the manufacturers is horrible stuff. Right? The way it's processed is really bad. You've taken out the other minerals out of it. It's just almost completely sodium chloride. And so it doesn't have any health benefits or very few. But in doing that, they've reduced their iodine exposure. And iodine is critical, amazingly critical. People die from iodine deficiency all the time without knowing it. So you look at this list, ADD and ADHD, sleep disorders, menstrual disorders, constipation, etc. So there's a whole lot there that can happen with iodine deficiency. And again, it's the same thing that happens with thyroid deficiency or hypothyroid. Okay, every organ that secretes something needs large amounts of iodine to excrete, right? That's just basic physiology. So the thyroid has the highest concentration. Actually, the first little bit of iodine really comes in and fuels the brain, the pineal gland, pituitary, etc. They don't take much, but they get the first crack at it. Then the thyroid, which takes a fair amount of iodine, and then what's left over goes to the glandular tissue. Now, in Japan, fibrocystic breasts, lumpy breast, breast cysts, breast cancer are at a fraction. Last time I looked, it was about 10%, but I haven't looked recently. Dramatically less than in the United States. Why? Because they eat seaweed, they eat fish, and they allow flooding of their land so that they get iodine from the ocean onto their plants and onto the soil that they're going to grow their plants in. We don't allow that here anymore. So first thing I do when a patient comes in and says, you know, I have really painful breasts premenstrually, I have lumps and bumps and some cysts, I will ask them, have you had any ovarian problems? Usually they have, because the ovaries also need a huge amount of iodine. And then I'll say, have you had your thyroid checked? Oh yeah, I did. My thyroid, I'm borderline hypothyroid. And I'm thinking, no, you're not borderline. You're just on the test numbers they're using, you're borderline. But in reality, that's not the case. Prostate swelling is largely related to a couple things. One is estrogen excess, and then overconversion to dehydrotestosterone, but a lot of it is from iodine deficiency. So again, look at this list. The Chinese have been using iodine to treat thyroid disorders for at least 1,500 years. I have some writings from a very famous Chinese doctor where he used deer thyroid gland plus seaweed, which was burned down, so it was pretty much just iodine, and he used that to treat thyroid disorders way more effectively than thyroid disorders are generally treated now, right? So it's a very fascinating dynamic. You need it to make stomach acid. So all of these things that we're looking at here, dry eyes, dry mouth, all of those things could be related to low levels of iodine and or hypothyroid. Okay, here's a picture of a thyroid. This one's on the right. You can see that it's enlarged, it's inflamed. It would be hypofunctioning, and it's called a goiter. You don't see too many goiters anymore. The center of the country used to be called the goiter belt because so many people have goiters. Now, the reason you get all this swelling is the thyroid is doing everything it can to get every molecule of iodine. So it swells, trying to capture any iodine. The same with breast tissue, fibrocystic breasts, etc. The glandular tissues are trying to get every single bit of iodine that they can. This is a picture. So these are some pictures taken when goiters were more common and thyroid deficiency was more common. Obviously, I believe it's your left, but the woman that's swollen, that's pre-thyroid treatment. So if any of these pictures bring anything to mind for you, you might want to get your thyroid checked. Here's another. The swelling, the edema in the face. And here you get this, not just the swelling, but even that little head forward. There's almost a depressive activity there. And here, does she look different or what? Crazy, crazy, a little bit of iodine. Now here's a picture. This is a woman that got iodine and then thyroid hormone. And the picture on the left was when she first went to the doctor. Figure 1D, she'd been under iodine treatment. Figure 1E, then she had been doing thyroid treatment. So pretty dramatic difference. So when I see young women whose parents bring them in because they're really not developing at a rate that we would expect or that they would expect, iodine is one of the things. There are obviously more, but iodine is one of the things that I'm going to consider in my diagnostic protocols. Okay. Picture on the left, it says sufficient dietary iodine, and you can see the hypothalamus. So the hypothalamus, if you've ever watched a movie about a submarine or about a nuclear power plant, you had people monitoring these huge boards with lights flashing and all these things going on. And that's kind of like the hypothalamus. It is monitoring almost everything in your body, your temperature, your hormone levels, everything. And then it sends messages through a closed system to the pituitary. Pituitary, there's the anterior and the posterior, anterior being the front, which produces 8 tropic hormones, meaning that they're going to go somewhere else in the body and stimulate something. So thyroid, stimulating hormone, adrenocortico, stimulating hormone, prolactin, which stimulates milk production and some other changes in the breast, follicle stimulating hormone, luteinizing hormone, etc. So the anterior pituitary is really running the show here, but it's running the show under orders of the hypothalamus. And so a lot of people out there, you've heard of the HPA Axis. That's hypothalamus, pituitary, adrenal axis. But they're also hypothalamus, pituitary, thyroid axis. All of those because you're getting feedback up to these glands. And so here you see it's creating adequate T3 and T4, and I'll talk in a minute what those are, which then you get a negative feedback and it says, hey, we don't need any more of this, no more TSH. And that's why TSH it really confuses people. There's an inverse relationship to the health of your thyroid. So the higher your TSH, the louder it's yelling at the thyroid to make more hormone. And so as the levels actually balance out, it won't have to yell as much. It's just saying, okay, all right, let's keep it right where it is. Let's keep it right where it is. So you get these negative feedback loops, negative meaning slow things down. Over here with insufficient iodine, you get down here, produces too much TSH because the T4 is too low. And so you're not getting the negative feedback, you're getting low feedback and low feedback here. So it keeps raising the TSH, screaming, make more thyroid hormone, help us, help us. And so, but there's no iodine to make the thyroid hormone out of, right? Because it's insufficient. And again, T4 means that there are 4 iodine molecules that are linked together by tyrosine. It's obviously way more complex than that, but that's basically it. T3, triiodinothyronine, is 3 iodine molecules that are connected. And so to make T3 from T4, which is critical in this, 1 iodine molecule is broken off. And so, and we'll get to that. There are certain chemicals that do that, the deiodinases, which are critical to break off that extra iodine molecule. Okay, now this one's going to be, look, there's a lot of words here. Let's just go one little bit at a time. TSH, as I just said, is the messenger. It's saying release more or less thyroid hormone. So the thyroid then in response to that releases, it also releases a little T1 and T2, but they're relatively unimportant. It releases primarily T4 and T3 into the bloodstream. The ratio is about 20-1. It's mostly T4 that gets released into the bloodstream. T4 has a longer half-life. It is pretty much a storage hormone. It gets converted to T3, which is 3 to 4 times more bioactive, meaning once it converts to T3, it really makes things happen. It's really the Energizer bunny. And again, tyrosine and iodine are the critical factors. Selenium is critical for these iodinases, which convert T4 to T3. Now, there's a big controversy here about selenium for this conversion. My recommendation is don't take selenium with the idea that you're going to do this conversion, because it can backfire, okay? But it is critical. Okay, here we go again. Another look at this same thing. Here's the T4 getting released. It comes down, and it can go to produce either T3, the Energizer bunny, or reverse T3. Now, reverse T3 is the trickster. If someone's under stress or trauma or on a low-calorie diet, then a low-calorie diet, which the body reads as stress, it may be good for you, it might be wise, but your body will read it as stress, right? You could be starving to death. It could be a famine. And so what will happen is the body will produce more reverse T3. And reverse T3 binds in the same receptors that T3 bonds to. And here you can see they compete for binding sites. And so if you have high T3, if you have high reverse T3, you're not using your T3. So it might look perfect on a blood test, but you're not utilizing it. And over here is a list of things that can cause problems with that conversion to T4 to T3. Up here are some factors that are important for production of thyroid hormones. And here, these are things that inhibit proper production. You notice one of these is fluoride, which is horrible for the thyroid, because it's in the same column of the periodic table, and it is an antagonist to iodine. So fluoride is a smaller number, which means it can bind. Fluoride can bind into the iodine sites and block the uptake of iodine, but iodine can't bind into the fluoride sites. So the fluoride has a huge advantage there in terms of binding. Bromine, same thing, or bromide, same thing. It has a lower molecular weight, and it also can bind into the receptor sites that would normally respond to iodine. So if you're eating things with bromine or exposed, bromine is in a lot of plastics. It's actually put into bread products. It's in tons of things. So if you're drinking fluoridated water and exposed to bromine, can almost guarantee that you have low iodine, okay? And then here we go, factors that improve cellular sensitivity. Okay, this is just another thing that shows T4 being converted to T3 in the liver, being converted to T3 in the kidneys, and being directly produced by the thyroid gland. Okay, here we have TSH, again, stimulates the thyroid gland, produces T4, that converts to either free and bound T3 or converts to reverse T3. So free T3 versus bound T3. When your medical doctor measures your T3 level or T4 level, often they will measure the bound form. And that's fine. There's a lot of information there. But if you go to a functional medical doctor or an endocrinologist, or to me, we're also going to measure free T3. That means how much is actually available. How much could we use that's not already being used? And that's a really important number. Okay, thyroid testing. TSH, thyroid stimulating hormone. The applications are very poor. I mean, it has a place. It's a really handy test. It's just grossly over-relied upon. The ranges vary 3.0 to 5.5. I believe it's the American Council on Endocrinology. That's the group, I'm not certain about their name, has said that once you get over 3.0, you are hypothyroid. no matter what LabCorp or anybody else says. Also, if you go to a fertility specialist, they're going to want you down under 2 because having a really, really balanced thyroid is critical for pregnancy. And so when they set up this range, they had a really poor pool. They just took everybody that wasn't on thyroid medication and did not have diagnosed thyroid disorders. And they said, okay, you're our pool. And then they came up with these numbers, horrible numbers. So these are all tests that one should have if they suspect thyroid disorders. With these tests, you can pin down 32 different thyroid disorders. Okay, 32. That's a lot. And that's just hypothyroid. So T3, reverse T3, free T3, free T4. T7 is an index of the ratio of T4 to T3. Antibodies, very, very important. And so the symptoms really are more reliable than the tests. But if you give me this whole cascade, we can figure out what's going on. Okay. In terms of hypothyroid, most MDs check for one type. That's, is your TSH out of range? Some, if they find it is out of range, will follow up with an autoimmune test for Hashimoto's. Almost none tests for the other. I put 3 types there to keep it simple. And then I said 4 types. Datis Karatsian, who's a brilliant man, genius, he says there are 32 types of hypothyroid. And in reading his information, I believe he's absolutely correct. Clinically, I find that I don't necessarily have to break it down into 32, but I do break it down into about 8 on a regular basis. If we're still having difficulty, then I'm going to look beyond that and look at all 32. However, that's a lot more than the 1.5 that your medical doctor is generally looking for. Okay, primary hypothyroidism. Okay, this is when the thyroid burns out for whatever reason. This happens a lot with childhood trauma, walking on eggshells kind of sense, and the thyroid literally just burns out, stops functioning well. Usually there's an autoimmune piece that goes well along with it. And this one's usually treated pretty well by MDs. They give levothyroxine sodium, which is a T4 supplement. However, if they give products with T3 also, about 50% of patients feel even better. Okay, that's because they have a secondary pathology of poor T4 to T3 conversion. So anyway, primary, they usually do a pretty good job. In this case, the TSH would be elevated. Everything else could be normal or low, okay? Pituitary hypofunction, here, the TSH is elevated. But again, this looks a lot the same as the primary hypothyroidism, so you'd have to look a little deeper. Primary hypothyroidism, these are some things to consider for treatment. Thyroid glandulars, in that case, you're actually taking ground up thyroid gland, which in a pinch, if you're on thyroid medication and the apocalypse comes, you can always shoot a squirrel or a chicken or something and grind up their thyroid gland. That's how they found out about this. They were giving people thyroid glandulars. Deer thyroids may be the best. They're really, really good. Anyway, and we use a lot of herbs, of course. I just left a couple things in here. This is for the pituitary hypofunction. And here we actually have to treat the brain and we have to treat the stress. So for that, we're looking at a lot of the same supplements. And I don't want to go into those too much because I don't think you should treat yourself for this. Everybody should be taking vitamin D, literally everybody, unless you live in the sun and your vitamin D levels are 60 or over. Otherwise, everybody should take that. Magnesium is the #3 deficiency in the country. The number of people magnesium deficient is horrifically high, and magnesium does hundreds of different jobs within the body. It's involved in many, many processes, including muscle relaxation. It's low magnesium can lead to heart attack, diabetes, etc. Under conversion of T4 to T3, here your TSH could be normal. So you go to your doctor and you say, Doc, I feel like crap. I don't want to get up. When I get up, I don't want to do anything. I'm having severe menstrual dysfunction. I'm gaining weight and I'm really bummed out and depressed about it. And they test your TSH and they go, well, that's not the problem. Well, if you get down here, you're going to find there is a problem because you're not converting that in relatively inactive form of thyroid hormone. You're not converting it to the active form. So you're not going to feel good, period. It's just no way. So these are some of the supplements that are beneficial for that. Google, which is a not the online service, but it's a Ayurvedic herb. We use a lot of Chinese herbs, but we would use Google in some cases. L-glutathione. Now, glutathione is the master antioxidant in the body. Some people argue that it's alpha lipoic acid, but for now we'll go with glutathione. But glutathione, I didn't use ever until very recently because it didn't work. It didn't survive, excuse me, getting through the stomach and couldn't be utilized. So I would give N-acetylcysteine, which is a precursor, and I got pretty good results. Then they came up with liposomal glutathione, which is better. Most of my patients won't take it because it tastes so horrific. And now there's just a new form that's come out. We just started carrying it a few months ago, and it's an L-glutathione, and it is not so bad tasting. People are willing to take it, and it actually does work. Okay, overconversion here. We got a interesting thing here. Here we've got total T3 and free T3 are high. Now that causes a whole other group of problems that are beyond my lecture today. And then this one also for overconversion, because you usually see this in polycystic ovarian syndrome, patients with a lot of insulin resistance and diabetes. And so it's a whole different ball game. And you get high testosterone often in polycystic ovarian syndrome, which really feeds this imbalance. Testosterone supplementation can also cause this. So in weightlifters, et cetera, people who are trying to really get a lot of muscle development, or in older guys who are wanting a little testosterone for some drive, you can see this particular problem with the decreased thyroid binding globulin. And here, the biggie is it's all about liver detoxification. All right. Now, I'm going to do a show on liver detoxification. I talk about it all the time. We do 10-day programs on liver detox. And all the time I have patients talk to their doctors who will say, oh, that's ridiculous. The liver doesn't need detoxification. If your doctor says that to you, find another doctor, because if they don't understand the basics of liver detoxification, there's a whole lot more they don't understand. Keeping the liver detoxified is critical for hundreds of different processes in the body. If the liver's toxic, you can get stone. You know, everybody knows about gallstones, but you can get kidney stones. In fact, they're very common. You can go online and see pictures of them. You can see film studies that show these. And they're a huge problem because then you don't get proper flow through the liver. But the really, really, really scary thing is, at this point, the estimate is that 25% of the world population has metabolic induced fatty liver disease. So we're used to alcohol-induced fatty liver disease. This is blown way past that. This is metabolic. Sometimes it's called non-alcoholic fatty liver disease, 25%. 25% of teenagers that you see walking around on the street have fatty liver disease. That can lead to liver fibrosis, that can lead to liver cirrhosis, which leads to death. So this is a huge problem, and you need to get that fat out of the liver, which is part of the liver detoxification process. So that's why I say, if your doctor says this isn't a thing, you actually just need to get a different doctor because it's a huge thing. 25%, 25% of that doctor's patients, and in many cases more, depending on what they're treating, have fatty liver disease. The doctor just doesn't know it. Okay. So this is scary stuff. I'm going to talk about this in a couple weeks. It may be the most critical thing I ever talk about. Other than water. I am going to talk about water soon. Water's just would seem like the easiest topic in the world, and it's one of the hardest, but I will be talking about it. Okay, elevated thyroid binding globulin. Again, you don't need to worry about any of this. I just want you to see that there are a lot of possible issues here around hypothyroid. Okay, so here we'd want to support the methylation pathways. We want things to be able to deal with methyl groups so that they are functioning properly. Choline, eat your eggs, right? Choline is one of the most important substances on the planet. It's grossly underconsumed. People got really afraid to eat eggs. Eggs are the #1 source. There are other sources like organ meats, all right? So you have your choice, eat some sheep kidneys or eat some eggs, right? And get that choline. Betaine hydrochloride, you can either take it or you can eat your beets because that's where this comes from, okay? B complex, that's gonna come from your vegetables. B12, that's gonna come from eating meat. So if you're a vegan, you're very likely to be low in 3 of these substances, and you're going to have to supplement if you want to stay healthy. Okay, if you're primarily eating fruit, you could get enough choline, you could get enough B complex, you will not get enough B12. Okay, these are things for liver detox. I'm not going to spend much time on them because I don't want you to treat yourself. Here are some things for healthy bile flow. So if you think you have these I'm okay with. If you think you have a slow gallbladder, you're getting discomfort under the rib cage on the right side over here, anybody in your family has had their gallbladder taken out, then it doesn't hurt to do beetroot, artichokes. What I didn't put in here are radishes, lots of vitamin C, a little dandelion extract, some phosphatidylcholine. These are all very safe in even high amounts. So I don't mind you treating your own gallbladder here. Thyroid resistance, I'm not going to go into this because this is really, really rare. We're seeing a bit of it though. And in this case, you really have to treat the adrenals, which have had to take up the load for the thyroid. And we would really do a lot more testing here, and we'd look at your hormone levels. However, this is not very common. Stress induced. Here, the biggie is the reverse T3. If you see high reverse T3, your body is under stress. Could be physical, could be emotional, could be mental, could be high mold levels. It could be heavy metals, but something has stressed out your body. And so when you see high reverse T3, it's your practitioner's job to put on their deerstalker cap, start smoking their calabash pipe, and pretend they're Sherlock Holmes. That's what this is. If you get just reverse T3, you know there's a significant problem, and now you have to smoke it out. And these are some of the things we would do for that. Mostly the things you all know that you should be doing all the time, right? To get rid of stress. Autoimmune, here, everything can be fine, but you're going to see a positive TPO. That's the thyroid peroxidase, or thyroid antiglobulin. And so it's actually anti-thyroid globulin. And so TPO is the enzyme that makes thyroid hormone, or assists in making thyroid hormone, thyroid peroxidase. Then the TAB is the actual hormone of your body. Usually the antibodies hit the TPO first, not always, but usually. And then when it's deeper, then they'll go at the thyroglobulin antibodies. But either one of these is considered Hashimoto's. Okay, it's an autoimmune thyroiditis. Now, most doctors treat this as though it's low thyroid. Often it is, but you need to do more. That doesn't treat the antibody problem. You need to smoke out the cause of the antibodies and the autoimmunity and fix that at the same time that you're supporting the wonky thyroid. Usually call it Hashimoto's. And again, TPO is the enzyme involved in the production, and thyroglobulin is the actual hormone. And if you increase the output of thyroid hormone, you can actually increase the damage. Why? Because you now have more thyroid hormone for your body to be attacking. This is one case where you definitely do not want to increase iodine. And that's why I recommend that people, if everything else is fine, take a little iodine. But I've seen people take mega doses and completely shut off their thyroid. It was quite frightening. No, I didn't tell them to, but they did it on their own. Animal thyroid products I really like for many of the other conditions, but you don't want to use it here. So you're already allergic or have an immune response to your own thyroid, and most of these come from pigs, and you may well have an immune reaction to the pig thyroid. So this is a case where I don't recommend these T3 supplements. Okay, everything that increases inflammation makes autoimmune conditions worse. Wheat, it's not even close. It's the worst that I've seen, and you have to avoid it in any autoimmune conditions, okay? I had one patient who was a nurse practitioner actually, and her TPO was at 1200. And I basically begged her to stop eating wheat. Just try it, give it a trial. Now, she worked at a hospital and got her blood checked every week, her TPO. Her TPO went from 1200 to 120 in about 2 months. That's almost a 90% reduction in about 2 months. That's just totally different in how it's going to damage her body. Also, vaccinations can trigger it because they have a lot of adjuvants in them. And adjuvants are designed, the purpose, this isn't a side effect, the purpose is to hyperstimulate your immune system. Well, if you hyperstimulate your immune system and you have an overstimulated immune system with autoimmunity, it can make it much worse. Okay. This could take a month to go into, but basically, there's an infinite number of different parts and correlations and connections in the immune system. One of the simpler things to look at is T helpers 1 and T helpers 2 for dominance. And in some autoimmunity, the seesaw gets out of balance, so there's too much Th2 activity. And sometimes it gets out of balance so that you have too much Th1 activity. Now, you can test for that by testing these interleukins. Okay, fortunately, the prices on that are coming down. And so if either group is high, you stimulate the other side. Now, 90% of Hashimoto's, the last time I looked, it's been a couple years, 90% of that is a Th1 elevations. Okay, so if that's the case, avoid Th1 stimulators. And those include Huang Qi astragalus. Oh my God, take away my Huang Qi. Echinacea, it stimulates that immediate immune response, which is a Th1 response. Beta glucans, which largely come from mushroom products, but particularly maitake mushrooms, licorice, melissa, these are all Th1 stimulators. You don't want to do any of those if you have Hashimoto's. Th2 stimulators, these are all fine. You need to investigate the mushrooms a little bit because some go one way, some go the other. But these are all Th2 stimulators. Generally, 90% of the time, safe with Hashimoto's. Okay, remove all your allergenic foods, remove the high glycoproteins, which I'm not going to go into right now. In either type of elevation, you're safe to use vitamin D plus cofactors, which includes vitamin K, fish oil, liposomal glutathione, and a couple of other things. You need to have your labs monitored at least annually. And in the Western system, what happens is if you test positive for Hashimoto's, usually they never test you again for the rest of your life. That's because they don't have any way to treat it. but we do have a way to treat it. So test that every year for sure. And then again, if you find out which side of the TH system it is, then use specific supplements. Okay, if you have thyroid symptoms, now you have a list there, get checked. If you get checked, do a full thyroid cascade. It's not going to break the bank. It's well under $100. So get a full thyroid cascade, not just the TSH. Low thyroid is actually very serious. One of the reasons we have an epidemic, and there are many, but one of them is people with thyroid disorders now live longer because we have drugs to keep it under control. Historically, people with thyroid problems usually died by their 20s because they couldn't fight off infection. So this is a big deal. Also, low thyroid is directly linked to high lipids, to high LDL levels. So it's a big deal. And the bottom line is don't treat this on your own. It's extremely complex. It took me years to learn all the details of it. So go to someone who understands all this and get treated, but first get tested. Okay, so I'm out of time. And I want to thank you for hanging in there and listening to this. Please tell your friends. I guarantee there is no doubt you know people with thyroid problems. Whether they know it or not, they have them. So please invite them to take a listen, take a watch. I want to thank you all for showing up. Be happy, be healthy.